Thank you all. So this is Rashida Akhtar. I am working as Child Protection and Gender Justice Advisor in Plan Bangladesh. And Plan Bangladesh is currently the Secretariat of Joining Forces Bangladesh, and I am the coordinator. So as we had a plan that country office will present one joint activity. So, and it was already selected that Joining Forces Bangladesh will present their recent child situation analysis. So I am presenting the analysis, but this analysis is a huge. So I have to selected a few slides, and I will not read all of them. I will skip most of them. Just I will give a glimpse of that situation analysis. So at first, the purpose of the study was to understand the latest child situation in a broader sense. And if we say it specifically, then to understand the progress in line with UNCRC and the progress in line with Sustainable Development Goals, as well as in line with Children Act 2013, what are the progress? So this and also to take some advocacy initiative. So this study has been conducted. So I will not share the methodology because my time is very short, but in short, I can say that this study has been conducted mostly by using the secondary data, and also the researchers taken interview from different stakeholders, policymakers, and also we included children voices in this report. I will share their special opinion in the presentation. So there are many areas. So first, as we said, in line with UNCRC, so the first issue is right to survival and health. And we see there are still child mortality and malnutrition and other things are our concern. And the significant gaps in economic class, age, and gender ethnicity remain constantly. And also still there is a gap of human resources and awareness raising on child nutrition, and government has a weak coordination. And there is another reason that the health services are highly costly. So most of the children cannot avail them. And from government side, there is a lack of monitoring. So am I audible? Is it okay?
Yes, okay. We hear you very well. Thank you.
So for child earlyhood and development, we see still our government has many commitment to ensure early childhood development, but still there are inaccessibility and lack of quality, and lack of teachers training, and insufficient funding, as well as government monitoring to see how their policy and laws is working. And then our next issue is education. And so there is also, the quality education is a big issue still now, and dropout rate of in secondary school is high still, and some specific classes of children like intersex children, Dalit, street children, they are still behind. They are still behind in accessing the education facilities. And yeah, there are, as you know, Bangladesh is one of the climate impact prone countries. So that is also impacting our children's education. And also that is so that our secondary school dropout rate is high, and the children became joined as child labor, and they became the victim of child marriage. So, and this issue is related to family environment and alternative care. So this is another significant area that the lack of financial resources is a constraint for both government side and non-government stakeholders. They are providing alternative care support, but their funding resources is still limited, and lack of adequate knowledge and lack of capacity of the staff and also the sensitivity, how to deal with these children are the most reason of the low quality of alternative service. And equality of girls, this is actually still there is a big gap and a huge discrimination in boys and girls. So we already shared that dropout rate in secondary school is high, and in terms of dropout, girls dropout rate is very high. And the participation of girls in Tibet is still very low because of our lack of awareness and lack of resource. And girls still face violence and fear both at home to work, to go to the school, and to work and on the way to school. So and child marriage rate is still 50%, more than 50%, and COVID-19 situation actually contributed it very negatively. So the dropout rate of girls from school and child marriage rate is still in an alarming rate. So the girls and women are exposed to physical, mental, and emotional harassment. So this issue is, and they are still facing the imposition of restriction in mobility and studying and avoiding going outside. And 35.3% of girls' parents fear of sexual harassment is a main cause for the child marriage. And violence against children is still remains a huge issue in Bangladesh. So, but there is no database to see that what are the numbers of the victim of the violence, and as well as the perpetrators. And also there is a lack of sensitivity of service providers, such as the police, the law enforcers, or in judicial process. They are not sensitized to deal with children and to deal with juvenile justice. And actually the traditional mindset of parents, guardians, and elderly people regarding their raising their children is still contributing a lot, because more than 50% parents and community people believes in punishment, so that the whole society reflects the same thinking, that without punishment children cannot be a good cannot be rare. So child marriage still is a big issue, and there are some reason behind child marriage. Socioeconomic and cultural factors, and poverty and fear of girls' safety and security are the reasons. And also according to UNICEF report, still child marriage rate is 59, and the COVID-19 pandemic situation again contributed to increase the child marriage situation, to adverse the child marriage situation. And child labor is still a big issue, and it is also a negative impact of COVID-19. So the pull factors is vulnerability to exploitation, lack of strong monitoring, and weak enforcement of law, as government has many times committed to reduce child labor and to stop the hazardous child labor, but lack of strong monitoring, this area is also lacking. So lack of legal protection, because there are so many laws and there are in discrepancy. One law says that before 14 years they cannot work, and some law says that before 14 they can work. So there are huge discrepancies. And lack of coordination, as government is there is a ministry for children and women together, but there is no independent department or ministry to coordinate with all the ministries and stakeholders for child rights or child related affairs. Drowning is another significant area, and almost 40 children drown in Bangladesh a day. So it is a fourth leading cause of death among children. So we need to see these drowning areas, and Because of excessive stress, loneliness, pressure to get married, uncertain future, addiction, family conflict, and depression, the suicidal case is increasing day by day. And it is also another area to look at. And juvenile justice, we had a long pending advocacy that the age of criminal age of children should be increased from 7 to 9, but government yet to agreed on this point. And also there is no separate children court, as the Children Act 2013 directed to establish a separate children court, but the government is yet to establish this court. So, and also the sensitization of the law enforcers and the officials who are who are engaged and involved with juvenile justice is a great reason for not to behave with children sensitively. So, and also lack of adequate human resources to deal with children in contact and in conduct in conflict with law. So this is another reason for juvenile justice areas. And in child rights governance section, there are so many things. Already I shared that poor coordination, lack of dedicated department, lack of capacity and sensitivity of the implementing agencies, and also the budget, appropriate budget are the significant areas that lacks to ensure child rights governance rightly. And also in terms of child participation, it is still our government has commitment in different policies and laws, but still it is not in government priority list. So children cannot share their views in preparing any policy, laws, and anything related to their life. And child budget is another area we raised our concern that budget allocation for the education and health sector are not much lower than the previous global standards. And also there has been a practice of child budget in till 2020 maybe, but after that we are not seeing that government is specifically indicating child budget in their budget allocation. So as like the health and education, in the same report, health sector also allocated the budget, which is very lower than the planned to reach 2% of GDP by 2025. So now I will share the children's opinion. Our children said that there are some area of discrimination or rights violation are menstrual hygiene, management for girls, lack of safety security, discrimination between boys and girls, sexual harassment, early marriage, domestic violence, trafficking, bullying and ragging, child labor, drug addiction. So their recommendation was to ensuring safety and security, increasing child participation, and building up a discrimination-free society, promoting equal opportunity for all children, arranging entertainment and recreational facilities, and changing societal attitudes. So, there are some recommendations. There are huge recommendations, and so I will not read them all. So there are some recommendations that is related to survival and health. So we ask for government to take initiative to increase purchase capability of the poor families and keep the food items, and particularly that of nutritional items within the reach of the poor family, and increase the number of physicians, pediatricians, and essential medicines in the centers, and ensure their availability in the respective service centers. And carry out awareness, ensure psychosocial counselors in each district hospital, And also for early childhood development, our recommendation was ensure proper monitoring and ensure from government so that their policy and laws will be implemented properly, and expand early childhood education, so that the official, the teachers who are giving the childhood services, they will be in right place. For right to education, we give emphasis in quality education, and also to introduce a uniform and non-discriminatory education system, and also to ensure adequate and appropriate integration of SRHR and well-being in the curriculum, and increase investment in ICT education with a special focus on children from remote areas, and ensure adequate playgrounds, that means the recreational activities in the schools. Right to family and environment. So we want government to carry out an alternative care system in Bangladesh and take necessary steps to improve the available alternative care system in light of the UN guidelines and alternative care. So for child protection and juvenile justice, some of our recommendations are sensitize the duty bearers, police, judges, court officials, Women's Rights and Gender Equality and About Children's Rights Act and CRC, and review and reform the relevant laws. So that they can be in a currently there are discrepancy in different laws. So if they review the laws, then there will be a similarity, and our children can enjoy the rights. So for childless governments, our special recommendation is to ensure effective child participation, and also to finalize a time-bound action plan to establish a separate directorate so that this institution can coordinate all the government ministerial institutions and other private sectors for ensuring child rights. And another recommendation was to establish an independent National Commission for Children's Rights to monitor the child rights situation and to demand the accountability from all the actors, and also a monitoring mechanism for ensuring the implementation of Children Act 2013 and strengthen the role of local government institutions, and also institutionalize child-friendly local government budgeting process through incorporation of specific code on children in the budget template of the local government institutions, provision of the participation of the children in the budget process in the relevant laws and manuals of the local government institutions. And also for financing, our recommendation is to recommend child budget report and ensure allocation of required budget as possible for implementing programs to realize of human rights. And given the financial constraint, diverse strategy for private sector engagement to influence private sector investment on the realization of the child rights. So eliminating gender stereotypes, there are some long-term, campaign recommendation for long-term campaign, and also to evaluate the different interventions, and based on that, to take new initiative to eliminate the negative norms and gender stereotypes from the society. And also include content on gender equality in the training manual for different service delivery personnel, so that they can be aware about the gender stereotypes and they can be sensitized and behave sensitizedly with these issues. And that's all from my end. I actually tried to make it within 10 minutes, but I am available here to answer any of the question.